Hi, my name's Curtis. I'm currently enrolled in my prerequisite classes for the registered nursing program. I'm doing my informative speech today on dementia. So let's start with what is dementia? According to dictionary.com, dementia is a condition characterized by progressive, persistent, and severe impairment of intellectual capacity, including memory loss, confusion, emotional instability resulting from loss of damage of neurons in the brain. So what does this mean? Some of the symptoms could involve personality changes. A lot of times you'll have sundown symptoms, where at night the symptoms get a lot worse than during the day. You'll have depression, anxiety, agitation. Agitations from a lot of times not being able to remember or able to do tasks that they were able to do in the past. Lack of control of physical movements, confusion, disorientation, sometimes even hallucinations. There will be problems communicating and using speech, memory loss, forgetting how to do things, forgetting birthdays, forgetting doctor's appointments, different things of that nature. And they'll have a problem just solving problems in general. There's different ways that they can detect and diagnose dementia. The most common usually starts with a cognitive test. And there they'll have the patient answer or do simple tasks and see how they do. There's also different brain scans that they can do that can detect things like Alzheimer's disease, which would be like a PET scan or an MRI. They can look at your spinal fluid analysis. They can do different neurological evaluations, different psychological evaluations. As far as the treatment and care for dementia, there's treatment, but there's no cure for it. There's going to be occupational therapy. With that, you're going to teach different coping mechanisms and learn how to prevent falls and make your home safer for whoever has dementia. You're also going to be able to prepare for the advancement of the disease with the education of knowing what's happening. There's different medications that are available too that can limit the symptoms. And then changing the environment. You're going to have to reduce clutter. You're going to have to basically toddler-proof your house at one point or another, because you're going to have to get rid of objects that will threaten the safety of your loved ones. You might even have to use some kind of monitoring system for whenever they get out of bed, so you know. I know my mother had dementia. I was one of her caregivers. And as it progressed, she ended up falling more. She forgot more and more, forgot birthdays, forgot names, didn't know who she was talking to. So, I mean, this is just a slow decline usually. So in conclusion, I've covered what dementia is. I've covered the symptoms that you would be able to diagnose this disease in its earliest stages, and I've given you possible treatments for the disease. So maybe now you'll be able to have a better insight in spotting symptoms to help your own families and the people you care about. Thank you very much for your time.